Sir, we will wait for 2-3 minutes, then we will going to start our session. Okay, sir, we will start with our session now.
It's audible?
Yes, sir, it is audible. Yes.
Okay, myself, Dr. Ghanshyam Patel, Associate Professor in Sharda School of Pharmacy. It's my pleasure to introduce my colleagues, Dr. Disha Suthar, who is currently working as an Associate Professor in Sharda School of Pharmacy. She completed the B.Pharm in Aryan School of Pharmacy, M.Pharm and PhD from Kadi Sarva Vidyalaya. She has one national and 16 international paper publication. She has 10 national and 8 international paper presentation. She also attended 15 national and 20 international workshop. She received the 5 lakhs grant from DST Inspire Fellowship and 1 lakh from SSIP. She achieved a great success in academic field. Now, I invited Dr. Disha Suthar to deliver the topic on self-medication and its demerits. Please, ma'am.
Thank you very much, sir. Am I audible?
Yes, ma'am.
Okay, thank you very much. So my topic for today's presentation is self-medication and its demerits. So we will start with the basics of self-medication. What is self-medication and what are the related dangers which are sorry related to self-medication. So let's start with the introduction. What is self-medication and what are the dangers which are associated with self-medication? So as the name suggests self-medication, उसका मतलब है कि खुद से ही अपना जो symptoms है, जो signs and symptoms है, उसका evaluation करना, खुद ही उसको diagnose करना और खुद ही उसकी treatment करके वो medicines ले लेना. Now ये चीज जितनी सिंपल दिखती है, because self medication has become very common कि हर किसी को अगर फीवर है तो कोई पेन किलर ले लेगा, थोड़ा सा भी गले में दर्द है तो एजिथ्रोमाइसिन या कोई एंटीबायोटिक का ट्रीटमेंट शुरू कर देगा. So self-medication has become a global phenomenon and it is the potential contributor to human pathogen resistance. तो एंटीबायोटिक रेजिस्टेंस अभी के टर्म के अंदर जो एक बहुत बड़ा फिनोमिना के तौर पे निकला है, दैट इज बिकॉज ऑफ द सेल्फ मेडिकेशन. बिकॉज विदाउट रेशनलाइजिंग द यूज ऑफ एंटीबायोटिक, पीपल आर टेकिंग एंटीबायोटिक्स जस्ट लाइक दैट. एक कॉमन फ्लू के सिम्टम्स के अंदर भी अभी हम सब एंटीबायोटिक लेना शुरू कर देते हैं.
Sorry to interrupt you, ma'am. Yes.
Yes,
Can you please do the full screen of your presentation?
is it okay?
Yes,
Now,
yes, now it is okay. Yes, you can continue.
thank you, thank you. So this adverse consequences of such practices should always be empathized to the community, and we must ensure how to deal with this things. What is the self-medication leading to? It leads to rampant and irrational use of antimicrobials without medical guidance, which leads in greater possibility of inappropriate, incorrect, or undue therapy, which leads to missed diagnosis, which may lead to delays in appropriate treatment, pathogen resistance, and maybe increased morbidity. तो सेल्फ मेडिकेशन जितना छोटी चीज लगती है, इट लीड्स टू सो मेनी डिजीज विच में लीड टू लाइक इनअप्रोप्रिएट ट्रीटमेंट, और वो ऐसा भी कर सकता है कि जो अप्रोप्रिएट ट्रीटमेंट मिल रही है उसको मिलने में वो डिले कर सकता है, विच में लीड टू मॉर्बिडिटी. So how do we define the self-medication? The self-medication can be defined as the use of drugs to treat self-diagnosed disorders or symptoms. So as the definition is saying, self-medication क्या है? It is used to treat the self-diagnosed disorders. मतलब the patient is diagnosing the disorders and the symptoms on his own or by the use of internet sources. Nowadays, the use of Google has increased so much कि डॉक्टर्स को भी अपने कैबिन या एरिया के बाहर लिखना पड़ता है कि प्लीज रिस्पेक्ट माय 6 year मेडिकल डिग्री, डू नॉट डिपेंड ऑन गूगल सर्च. तो सेल्फ मेडिकेशन not only deals with directly taking the medication, it also deals with self diagnosis. मतलब कि पेशेंट खुद ही डायग्नोस करेगा अपने डिसऑर्डर्स को और सिम्टम्स को, एंड उसके बेसिस पे ही विल आइदर टेक द मेडिकेशन which may be like an intermittent use or continued use. मतलब जो एंटीबायोटिक या तो 1 week या 10 दिन के लिए उसको प्रिस्क्राइब की गई है, द पेशेंट में टेक इट टू द फॉर द पीरियड ऑफ 1 month और 2 month, या फिर ऐसी एंटीबायोटिक्स जो लॉन्गर पीरियड के लिए यूज होती है. फॉर एग्जाम्पल इन केस ऑफ टीबी और इन केस ऑफ माइक्रोबैक्टीरियम इन्फेक्शन, उस केसेस में ये जो सारी प्रिस्क्राइब्ड मेडिसिन है फॉर 6 months और 12 months, जब सिम्टम्स खत्म हो जाते हैं पेशेंट स्टॉप्स टेकिंग द मेडिकेशन बिकॉज द सिम्टम्स आर नॉट विजिबल. तो इसकी वजह से व्हाट हैपेंस इज अ ड्रग becomes not useful for chronic or recurrent disease or symptoms. दूसरे वर्ड में अगर हम लोग बोले तो सेल्फ मेडिकेशन को ट्रेडिशनली ऐसा डिफाइन किया गया है, द टेकिंग ऑफ ड्रग्स, हर्ब्स और होम रेमेडीज on one's own initiative or on the advice of another person without consulting a doctor. मतलब कि डॉक्टर को कंसल्ट किए बिना what is done is the patient is diagnosing himself या किसी और लोग की या और पर्सन की हेल्प की वजह से the person takes the medication on his own. So what are the statistics? Generally speaking, self-medication is considered as very common practice, specifically on those communities and those countries which are economically deprived. But nowadays, the healthcare services are getting costlier, and in developing countries, the healthcare facilities are not available. Hence, the time of self-medication becomes an obvious choice for the healthcare service. तो जब हमारे पास हेल्थ केयर सर्विसेज इनफ अमाउंट में अवेलेबल ही नहीं है, द आइडियल रेशियो ऑफ अ डॉक्टर टू द पॉपुलेशन इज 1:1000. Like for 1000 people, there has to be one doctor. This ratio is maintained very well in urban areas of our country, but we all know what is the condition of the rural area or rural areas where the amount of patients are much more than and what is suggested by the WHO. Furthermore, it is also noticed or note that the purchase of drug and many drugs can only be purchased with prescription in developed countries or OTC in developing countries. तो जो भी चीजें which can be considered as a prescription medication, बहुत सारी चीजों के पीछे there are scheduled H drugs which are not to be sold without the prescription, वो ऐसे ही दी जाती है. और जिन जिन चीजों को या जिन जिन मेडिकेशन को प्रिस्क्राइब्ड मेडिकेशन के कंसिडरेशन में लिया जाता है इन डेवलप्ड कंट्रीज, डेवलपिंग कंट्रीज के अंदर दीज ड्रग्स आर कंसिडर्ड एज ओटीसी ड्रग. मतलब आप जाओ एंड यू गेट द मेडिकेशन, without the prescription. Why self-medication? Self-medication के reasons क्या हो सकते हैं? One is the patient's wish to get a greater role in maintenance of his or her own health. This have become a very common thing. Like हर किसी को अपनी health का ध्यान रखना है. So what they start doing is they start taking the multivitamin tablets whether they are required or not. They start taking the calcium tablets whether they are required or not. When they start taking the vitamin D supplements, जरूरत है या नहीं वो check ही नहीं करते हैं. Which may lead to like बहुत छोटी छोटी बातें may lead to higher complications in longer terms. So modern consumers or patients, which they wish to take a greater role in the maintenance of their own health, and they are often competent to manage the chronic and recurrent illness. But after proper medical diagnosis and professional advice. So common medicinal advice like the use of H2 receptor blockers, topical corticosteroids, antifungals, oral contraceptives, ये सारी चीजें if the patient is self-medicating, it can be considered as the okay version, but they are unwillingly they are unwilling to submit their own concerns to the doctor. They are understandably unwilling to submit the inconvenience of visiting a doctor for for what they rightly feel they can manage on themselves. So the patient may feel that they have adequate information about whatever things they require related to symptoms, related to the treatment options, and they tend to not feeling willing to go to the doctor for the specific treatment, and that is leading to self-medication. So self-medication, which is very common, the number of reasons which I have listed here may be the urge of self-care. Because I want to take care of myself, I must have good multivitamin tablet daily. I must have a calcium tablet so that my bone strength remains the same. And I must have vitamin D tablets every once in a while to have a good balance in my body. This may lead to unnecessary use of the OTC products. Second one is feeling of sympathy towards family member in case of sickness, specifically for child. If the child is having fever, rather than waiting for 2 or 3 days for his or her immunity to work with the fever, what we do is we directly give the medication to the kid that you take this medication, it is good for you, and आप जल्दी ठीक हो जाओगे. Because of the sympathy towards the family member, this thing happen. Second is lack of time. डॉक्टर के पास जाना, उनके पास अपॉइंटमेंट लेना, वहां पे वेट करना, मेडिकेशन लेना, या फिर टेस्ट वगैरह के लिए जाना. That is not that time luxury is not available for everyone. Next one is lack of health services. In case of urban areas of India, the health services are very good. But in case of rural area, we are still working on the health services for those patients. So वहां पे the self medication becomes an utmost necessity where the doctor or healthcare professional is not available. Next one is financial constraint. Because we are still in the developing phase, financial constraint play a big role in case of the self medication. Next one becomes ignorance, misbeliefs, or extensive advertisement and availability of drugs other than drugs shops. तो कई बार वी आर इग्नोरिंग द सिम्टम्स एंड साइंस के ये तो 2-3 दिन में ठीक हो जाएगा, पानी नहीं पिया इसलिए ये हो रहा है, या खाना ठीक से नहीं खाया है इसके लिए ये हो रहा है. सो इग्नोरेंस एंड मिसबिलीफ डू मोर हार्म्स देन दे डू गुड फॉर यू. Other factors may include education, the family of a person, society, laws or rules and regulations related to medications, availability of drugs, and exposure to advertisement. अभी के टाइम में the advertisement are so tempting that people, whether they require or not, they tend to take the medications. For example, Revital. Everyone wants to take Revital to feel energetic. Okay, so that is the exposure to advertisement, which shows that if I take one medication, I will be healthy, and that may lead to self-medication. It is not that self-medication is always harmful. There are certain benefits which are associated to the self-medication, which are the potential benefits associated at individual level is one can take active role in his or her own healthcare. कोई खुद अपनी हेल्थ का ध्यान रखना चाहता है, इससे अच्छी बात कोई और हो ही नहीं सकती है. एंड दैट अ पर्सन इज टेकिंग द एक्टिव रोल, और the person is taking active role in his or her own healthcare is a good point which may lead to self medication. Second is self reliance in preventing or relieving minor symptoms or conditions. जैसा कि प्रीवियस लेक्चर में हमने पढ़ा, देर आर वेरी कॉमन सिम्टम्स, जैसे कि हेडेक है या फीवर है या वॉमिटिंग है या नोशिया है. इतने छोटे छोटे एलिमेंट्स के लिए डॉक्टर के पास जाना मे नॉट बी गुड थिंग. तो वो पर्सन, इफ ही और शी इज सेल्फ रिलायंट इन दैट केस, he may feel that the self medication is a way to go. नेक्स्ट इज एजुकेशन अपॉर्चुनिटीज ऑन स्पेसिफिक हेल्थ इश्यूज. जैसे कि स्मोकिंग नहीं करना है, ऐसा आता है. बिकॉज ऑफ दैट द पेशेंट मे बी looking to get the nicotine patch. Second is the products to treat heartburn like Eno or Digene. ऐसी products की advertisement may lead to self medication. Next one is convenience. It is very convenient to have a strip of paracetamol at the home. Whenever you feel pain in your body, take one medication and you are free from pain. So convenience plays a big part in case of self-medication. Next one is economy, particularly because medical consultations have charging so much that can be avoided when the patient is taking medication on his own. At community level, what it does, a good self-medication also provides the benefits like saving scarce medical resources from being wasted on minor condition. कॉमन फ्लू जैसे सिम्टम्स के अंदर बहुत ज्यादा मेडिकल रिसोर्सेज को वेस्ट करना इज नॉट अ वाइज स्टेप. तो वो रिसोर्सेज को वेस्ट करने से ये सेल्फ मेडिकेशन में प्रिवेंट अस. सेकेंड इज लोअरिंग द कॉस्ट ऑफ कम्युनिटी फंडेड हेल्थ केयर प्रोग्राम्स. there are so many healthcare programs which are funded by the community, and उसका cost कम करने का काम करेगा ये self medication. Next is reducing absenteeism from work due to minor symptoms. Headache है और इसके लिए आप छुट्टी ले रहे हो, that can be reduced by self medication. Next is reduce the pressure on the medical services where healthcare persons are insufficient. Suppose in the era of COVID-19, everybody dependent on medical providers or the doctors for the treatment, the number of doctors will always be less to serve this huge community. And in that case, the self medication may help in reducing the pressure or the burden on the medical service provider. Next is increase the availability of healthcare to populations living in rural or remote areas, जहाँ पे the availability of healthcare professional, either a pharmacist or a doctor, is not there. So in that cases, the self-medication provides potential benefits to the patients. It also helps to prevent and treat the symptoms and ailments that do not require a doctor. Suppose a person has a minor cut. In that case, the person do not require any medical attention. In that case, this will prevent the time and resources which are available with the healthcare provider. Next one is fever, headache, indigestion, mouth ulcer, nausea, cough, acne, allergic conjunctivitis. It can be treated by self medication. तो जैसे previous lecture में we had discussed, or sir has discussed about the common signs and symptoms and how they can be treated, that can be taken very easily for the self medication. But the only thing which is to be concerned is that if the symptoms remain persistent, then you must seek doctor. So the slide which was most important in common management of symptoms was when to see doctor when the symptom commonly persists. Now we talk about what are the risks associated with self-medication. That is, how simple this self-medication looks like, and उसकी वजह से क्या-क्या possible problems हो सकते हैं. The first risk which is associated is incorrect self-diagnosis. Because if I search 2 or 3 symptoms in Google, it may show various diseases starting from fever or flu to cancer. So I cannot diagnose myself based on Google or based on some other person's advice, which may lead to incorrect self-diagnosis. Incorrect self-diagnosis will lead to incorrect treatment therapy, and incorrect therapy will lead to incorrect, like the person will not be cured. And if the person is not cured, it may lead to some other diseases growing inside the body of a person. So incorrect self-diagnosis can be the one of the major risk factor. Second is failure to seek appropriate and medical advice promptly, because the person is feeling that it is very common to have heartburn because मैंने आज कुछ spicy खा लिया है. It will be okay with the it may actually be the symptom of heart attack or maybe congestive heart failure. So just because the person is self-medicating with the small symptoms like heartburn and acidity, he may not differentiate between a heart attack and what is a heartburn. So in that cases, appropriate medical advice prompt time पे नहीं मिला, उसकी वजह से the person may lose his or her life. Next one is incorrect choice of therapy. तो as we already discussed कि अगर diagnostic ही ठीक नहीं है तो फिर choice of therapy will not be correct. So that leads to the problem. Next one is failure to recognize special pharmacological risks. स्पेशल फार्माकोलॉजिकल रिस्क मतलब कि अगर मैं कोई एंटीबायोटिक ले रही हूँ एंड इन दैट केस द एंटीबायोटिक इज आई एम पर्टिकुलरली like resistant to that particular antibiotic, that antibiotic is not going to work in my body and that may lead to pharmacological risk, like वो infection body में बढ़ता ही जाएगा and I will not be able to treat that medical infection. The next one is failure to recognize or self-diagnose contraindications, interactions, warnings, and precautions. Majority of medications के लिए the self-diagnosis leads to contraindication because the patient is not aware of what the medication will not be taken with. जैसे टेट्रासाइक्लिन जैसा एंटीबायोटिक मिल्क के साथ नहीं लेना है, दिस इज अ वेरी कॉमन सिम्टम्स एंड मतलब वो बहुत ही कॉमन कॉन्ट्रा इंडिकेशन है, बट पेशेंट में नॉट बी अवेयर विद दिस इंडिकेशन एंड विच में लीड टू फेलियर ऑफ द ट्रीटमेंट. दूसरा, कोई मेडिकेशन जो है वो फूड के साथ इंटरेक्ट कर रहा है या वो कोई ड्रग के साथ इंटरेक्ट कर रहा है, तो वो चीजें द पेशेंट वो इज सेल्फ मेडिकेटिंग मे नॉट बी एबल टू रिकॉग्नाइज विच मे लीड टू फेलियर ऑफ द ट्रीटमेंट. The next one is failure to recognize that some active substance is already being taken under different name. तो जब पेशेंट को दो सेम नेम वाली चीजें मिल रही है तो he may get confused about what medication he is taking and what is not to be taken. So in these cases, the potential risk of self medication happens at individual level. Next one is failure to report current self-medication to the prescribing physician. Just because I have taken the medication without dealing with the with the doctor or with the physician, I will not like to report that to the physician that मैंने ये treatment से पहले already अपने खुद से ये medication लेके रखी है. So that may lead to like do potential risk to the patient. Next is failure to recognize or report the adverse drug reaction. अगर कोई adverse drug reaction हो रही है तो I will not be able to recognize the adverse drug reaction because I will consider it as ये तो medication लिया है तो ऐसा होगा ही, and I will not be reporting the adverse drug reaction to the medication. Next one is incorrect route of administration. There are so many people who I have seen that they are taking the orally disintegrating tablets by simply by swallowing. तो ये बहुत ही सिंपल चीज है जो एक फार्मासिस्ट समझ सकता है that ODTs are to be kept in the mouth. उसको ऐसे ही नहीं swallow करना है, या कोई मेडिकेशन ऐसा है जिसको आपको कट करके नहीं लेना है, जैसे एनडीडीएस वाले लेक्चर में मैम ने बताया था that in case of novel drug delivery system, if you cut the tablet तो वो क्या करेगा, it will lead to the release of dose at one point. तो route of administration when the patient is not able to understand, कुछ drugs ऐसी है जो below the tongue लेने हैं, specifically vitamin B12, तो ऐसे medications अगर वो लोग ऐसे नहीं ले रहे हैं तो it may lead to reduce the effect of the drug in case of self medication. दूसरा है the for NDDS it may lead to fatal side effects. तो जब भी एनडीडीएस प्रोडक्ट यूज करते हैं नॉन नोवेल ड्रग डिलीवरी सिस्टम, उसकी बहुत सारी साइड इफेक्ट्स हो सकती है. सम ऑफ देम में इंक्लूड, अगर द पर्सन इज अल्कोहलिक तो जो एचपीएमसी का मैट्रिक्स है इट विल ब्रेक एट दैट पॉइंट एंड द पेशेंट विल गेट द डोज एट अ टाइम. अगर पेशेंट को पूरे दिन का डोज एक ही टाइम पे मिल जाता है तो इट मे लीड टू टॉक्सिक इवेंट्स और टॉक्सिक इफेक्ट्स. So in that cases, it may lead to fatal side effects. Next one is inadequate or excessive dosage. When the patient is not knowing कि कितना डोज लेना है, तो या तो वो कम डोज लेगा बिकॉज ऑल आर केमिकल्स और हमें बहुत ज्यादा दवाइयां नहीं खानी चाहिए, वो मेरे लीवर को खराब करेगी, वो मेरे किडनी को खराब करेगी, या द पर्सन विल टेक एक्सेसिव डोज बिकॉज वन डोज हैज डन नथिंग टू रिलीव द सिम्टम. तो इन दैट केस द पेशेंट में टेक की फीवर का के लिए पैरासिटामोल ले लिया है पर अभी बिल्कुल भी फीवर नहीं उतरा है, तो एक और टेबलेट ले लेता हूँ. दैट मे लीड टू एक्सेसिव डोजेज ऑफ द फॉर्म ऑफ द ड्रग एंड विच मे लीड टू पोटेंशियल हार्म टू द पेशेंट. एंड नेक्स्ट वन इज एक्सेसिव प्रोलोंग्ड यूज. आप पेशेंट को रिक्वायरमेंट है या नहीं है, बिकॉज वो डॉक्टर को ठीक होने के बाद दिखाने नहीं गया है, द पेशेंट इज टेकिंग द मेडिकेशन फॉर एवर एंड फॉर एवर, whether वो required है भी या नहीं, the patient is not taking care of that thing. This thing specifically happens in habit forming drugs, जहाँ पे the patient takes the medication till the time it becomes very difficult for the patient to come out of the habit. The next one is risk of dependence and abuse, because the medication which is given for say sleeping, for inducing the sleep, या for वो schedule X drugs होंगी which can cause the dependence and abuse in the patient, because the patient has become so dependent on that medication for the purpose of sleeping. उसके बिना उसको नींद नहीं आ रही है, या उसके बिना उसको he cannot be having a clear mind. So because of that, the patient will come again and again and use the drug for a prolonged period of time, whether or not it is required, and it will lead to abuse of drug. वो फिर ड्रग का अब्यूज करेंगे. The next one is food and drug interaction. Because the patient is not aware of the food and drug interaction, कौन सा फूड नहीं खा सकते हो, कौन सी ड्रग के साथ, वो बहुत ध्यान में नहीं रखते हैं. And because of that, they do not take care of what medication they are taking and what is not to be taken with the medication. फूड के साथ ड्रग का इंटरेक्शन बहुत हो सकता है. इट मे बी अ सिंपल मिल्क, it may be a cheese, it may be alcohol, which are very common food nowadays, which will act or interact with the drug. जो दो चीजें कर सकती हैं, one is they can reduce the impact of medication, the other is they can synergize the effect of the drug, which may lead to side effect or under effect of the drug. Next is storage in incorrect conditions or beyond this recommended shelf life. हम में से 50-60% will be those people who will be still storing the syrups and all in the refrigerator, जहाँ पे clearly mention है that do not refrigerate the syrups. ठीक है, तो हम मतलब it is very common to see that the people have not stored it in the correct shelf or correct conditions which are to be, जो patient को रखना चाहिए. And फॉर रिकमेंडेड शेल्फ लाइफ, कितने लोग ऐसे होंगे जो कि एक्सपायरी डेट चेक करते होंगे बिफोर टेकिंग द मेडिकेशन, बिकॉज वो स्ट्रिप या वो टेबलेट्स हमारे घर पे पड़ी है तो उसको हम खा सकते हैं, वो हम बहुत ही कॉमनली ये चीज को नोटिस करते हैं. नेक्स्ट वन इज paracetamol, which is an antipyretic and analgesic thing. It is in larger dose can cause liver failure. तो पैरासिटामोल तो अभी हर कोई मतलब जैसे डेली मेडिकेशन है वैसे ले रहा है, तो इट कैन कॉज लीवर डिजीजेस और लीवर फेलियर्स इन लार्जर डोजेस. मोर देन 6 डोज पैरासिटामोल के अगर कोई इंसान ले रहा है इन अ डे, in that case he or she will have liver failure. Next one is it may lead to financial losses because the recovery becomes delayed, and because the recovery has become very much delayed, वो ultimately बहुत ज्यादा costly हो जाता है. तो सेल्फ मेडिकेशन करने के चक्कर में, बिकॉज वी वेर टू सेव द मनी, क्योंकि हमको डॉक्टर को नहीं देना था या नहीं था या कुछ भी फाइनेंशियल रीजन की वजह से हमने जब भी सेल्फ मेडिकेशन शुरू किया, इट मे ऑल्सो लीड टू फाइनेंशियल लॉस, बिकॉज वो चीज को ट्रीट करते 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 जो पैसे भरने पड़ते हैं, दैट इज मोर देन what is what we might or he or she might have saved because of self medication. कम्युनिटी लेवल पे वो क्या कर सकता है, इट कैन रिजल्ट इन इंक्रीज्ड इन ड्रग इंड्यूस्ड डिजीज. ड्रग इंड्यूस्ड डिजीज का मतलब सिंपली इतना है कि इट विल लीड टू more resistant species in case of antibiotics, and that is why World Health Organization and our country both have started the rational use of antibiotic. उसका एक national action plan बना है where they are constantly teaching the medical providers or healthcare providers that the antibiotics are to be taken rationally and not irrationally. This will lead to a prevention of wasteful public expenditure. मतलब कि कम्युनिटी लेवल पे जहां पे हर कोई अपना फंड इकट्ठा करके ये ट्रीटमेंट के लिए पैसे दे रहा है, इफ इन केस ऑफ सेल्फ मेडिकेशन समथिंग रॉन्ग हैपेंस और इंड्यूस्ड डिजीज हैपेंस, वो जो रिसोर्सेस है, जो फंडिंग उन्होंने इकट्ठा की है, दैट विल बिकम वेस्ट. नेक्स्ट वन इज नेचुरल प्रोडक्ट्स. अब ये हर कोई ऐसा मानता है कि इट इज नेचुरल, दैट इज व्हाई इट इज सेफ. Okay, but nature has so many chemical compounds which are having difficult structures and so many chiral centers जो कितनी इंटरेक्शन कर सकता है फूड के साथ और अदर ड्रग्स के साथ, वो किसी को नहीं पता. This is an example of paclitaxel which is obtained from the Pacific yew tree. वो कैंसर ट्रीटमेंट के लिए यूज हो सकता है. हम सबको इतनी सारी मेडिकेशंस पता है या इतने सारे प्लांट्स पता है जो वी शुड नॉट यूज ओरली. Okay, so all the products which are natural वो safe है, that cannot be considered as true. So that is the one thing which may lead to a potential risk as a self medication, because हर कोई, because it is natural, because it is herbal, so we can take it very easily, so that becomes a potential harm to the patient or the community. Next is people are combining the allopathic and Ayurvedic medication, and it is a big no-no. You cannot combine the allopathic and Ayurvedic medication. If the treatment or if the symptoms are acute, go for Ayurvedic treatment. Go for allopathic treatment and follow by allopathic treatment. Go with the Ayurvedic treatment to maintain the thing. But दोनों ही चीजें allopathic और Ayurvedic एक ही साथ करना है, that is leading to a big risk product in case of self-medication. What can be done to prevent the self-medication, or what can be done to prevent the risk which are associated with self-medication? Why we are doing this? Because हम सबको पता है कि सेल्फ मेडिकेशन सस्ता है और अच्छा भी है. तो हम सिर्फ ये कर सकते हैं that we can deal with the potential risk which are associated with the self medication. इसमें सबसे बड़ा रोल जो आता है that is of a healthcare professional. So they are the one who are playing pivotal role in preventing the risk of self medication, because he will work on these three main therapeutic aspects of professionalism, that is information, therapeutic advice and education. इंफॉर्मेशन मतलब कि जब भी हम लोग कोई प्रेस्क्राइब कर रहे हैं मेडिकेशन या हम लोग कोई मेडिसिन किसी को दे रहे हैं, तो वी गिव प्रॉपर इंस्ट्रक्शंस एंड उसको हम पेशेंट को समझा सकते हैं दैट दिस मेडिकेशन विल हेल्प टू रिड्यूस दिस पर्टिकुलर थिंग, so that the patient will be able to make his or her own decisions. वो ऐसे इंफॉर्मेशन पेशेंट को ये कॉम्प्रिहेंड करने में हेल्प करेगा दैट माय ट्रीटमेंट और माय डिजीज इज बीइंग मैनेज्ड प्रॉपर्ली. नेक्स्ट इज थेरेपेटिक एडवाइस. सबसे बड़ा जो प्रॉब्लम है दैट इज लैक ऑफ थेरेपेटिक कंप्लायंस. जितने टाइम तक, जितने दिन तक पेशेंट को मेडिकेशन लेने के लिए बोला जाता है, या तो वो उतने दिन के लिए नहीं लेता या तो वो उससे बहुत ज्यादा दिन के लिए लेता है. एंड बिकॉज ऑफ दैट एक्यूट एंड क्रोनिक ट्रीटमेंट रिफ्लेक्ट्स अ पुअरली अंडरस्टूड और इनकम्प्लीट डिस्क्रिप्शन ऑफ द ट्रीटमेंट एम्स. सो अगर पेशेंट को प्रॉपरली इन्फॉर्म नहीं किया है दैट व्हाट दे आर अनलाइकली टू यूज, if they are not likely to use the medication correctly, क्या क्या हो सकता है, then the patient may be prevented from the risk of antimicrobial resistance. However, if the directions for use and the limitations of given drug are explained well, like what is the dose, कितने टाइम तक लेना है, कितने टाइम की ट्रीटमेंट है, कैसे लेना है, then patient के पास एक proper set of guideline है which they will help to take the drug correctly and अभी भी and in future भी. And because of that, the inappropriate and erratic self-medication will be prevented. Next one is education. Inappropriate self-medication is the result of medical model from which people have learned. So proper health education should be given to patient, and proper health education should be given by regularly adopting the educational attitude. we can have effect on large sectors of the population, on people who in turn may directly influence their friend and family. So in this aspect, it is of particular importance with respect to self-medication of children by their parents or take carers. What is the role of pharmacist? Pharmacist is one of the key role players in educating the customers about the proper use of medicines which are intended for self-medication, and for that necessity steps are to be taken for the training and practice. Pharmacist अपने कस्टमर को गाइड कर सकता है to consult the physician before taking any medication by himself. Unlike above role, pharmacist can also function as a communicator. Communicator means in order to address the condition of a patient appropriately, pharmacist must ask the patient key questions and pass the relevant information to him or her. मतलब कैसे मेडिसिन लेना है, कैसे उसको सेफली लेना है, and what to do if some adverse effect happens to the patient. Next is quality drug supplier. Pharmacist must ensure that the product that he or she purchases are from reputable sources and of good quality. He can also act as trainer and supervisor, and to achieve this, pharmacist must develop a protocol for referral to pharmacist, protocol for community health workers, which involves the handling and distribution of medicines. Next is collaborator. Pharmacists develop quality collaborative relationship with other healthcare professionals like doctors and nurses, national professional associations, and pharmaceutical industries and governments and patients and general public. So we are the link between the patient and the doctor to prevent the potential risk which is associated with self-medication. These are the commonly culprits which people are taking as a self-medication. That is the natural products, the semi-synthetic products which are half natural, half laboratory में बनाए हैं. Next one are pain relievers, antibiotics, stimulants, anti-allergic agents, laxative, antacids and vitamins. ये सारे medications जो है they are now considered as one over-the-counter drugs. इसकी वजह से क्या क्या हो सकता है is it may lead to drug resistance, allergic reaction, habituation, misdiagnosis and drug interaction. So what happens in interaction? If the patient is taking 2 fever pills, because एक fever की pill की वजह से उसका fever जो है वो नहीं जा रहा है, या they are taking alcohol, because of which the drug which was actually supposed to be sustained release or extended release वो एक ही moment पे release हो रहा है. So the patient is not knowing that 2 या 3 fever pills और जो alcohol है वो उसके body में जाके कौन से टाइप की इफेक्ट या इंटरेक्शन कर सकता है. तो बिकॉज ऑफ दैट द सेल्फ मेडिकेशन बिकम्स डेंजरस फॉर द पर्सन बिकॉज द पर्सन मे हैव adverse events or maybe risky factors for his life. Next one is misdiagnosis of illness. The patient might think that the patient is having high or viral fever. But what if it is not viral fever? What if it is swine flu or say COVID or any other thing which the patient is not able to diagnose on himself or herself or him or her own? So in that case, it becomes misdiagnosed. And because of that, the fever or the disease which is there in the patient may aggregate so fast or aggravate so fast that he or she may directly will have to go to ICU or say for higher treatment. Next is insufficient dose. हर किसी को self medication करना है, but if the patient is taking the proper dose, yes or no, the patient is not aware of that. Everyone wants to take vitamin C tablets. In case of COVID-19, vitamin C tablets, B12 tablets, multivitamin tablets, everyone was taking like it is just a daily routine or daily test. The person has to see himself whether he or she is actually not having sufficient quantities of vitamins in their body or not sufficient quantities of vitamin C in the body. And even if the person is taking say vitamin C, vitamin B12, vitamin D3 or maybe calcium tablets, whether the patient is taking the proper dose or not. So this is the common thing that if a patient or Google does know more than a doctor, how is that possible? that the 6-year degree of the medical doctor just goes into waste by Googling the things on the internet. Next is habituation. The person is taking pain reliever for a headache. Every now and then, the people are nowadays having headache because of various reasons. And what is the underlying cause of the headache? The person is not taking care to identify कि उसकी headache का reason क्या है. Whether it is stress, whether it is migraine, whether it is cluster headache, या सिर्फ उसने कम पानी पिया है, या वो ज़्यादा बोला है. What is the condition which deals with the pain in the patient? Because the patient is having pain or headache, वो क्या करेगा? He will take the medication immediately, and because of that, now even a mild dose or mild headache will not be bearable for the patient, and now he or she will have to take higher amount of dose in order to treat the headache. So habituation is very simple, that you start with the dose and you then becomes a smallest symptom unbearable for the patient कि जब तक आप मेडिसिन नहीं लोगे आपका जो हेडेक है वो बिल्कुल भी ट्रीट या क्योर नहीं होने वाला है. Then comes allergic reaction. Majority of people are allergic to cough or cold medications. If the patient is knowing कि वो कौन सी medication के साथ allergic है, क्या वो sufficient terminologies में precautions ले रहा है? अगर उसको ये बात पता नहीं है, तो do not treat yourself with drugs. In conclusion, I would say self-medication is an alarming concept. इतना सेफ, इतना सही चीज सेल्फ मेडिकेशन लगता है, वो एक्चुअली नहीं है. It would be safe if the people who are using it have sufficient knowledge about the dose of medication, the time of intake, the side effects, maybe what will happen if in case of overdose. But due to lack of information, it may cause serious side effect as antibiotic resistance, skin problems, hypersensitivity, allergy, and much more, which is not included in this slide. So, in one conclusion, I would say self-medication seems to be very simple and very effective to treat the conditions which are very common, like headache, nausea, vomiting, diarrhea. But if the symptoms persist, it is the duty of the pharmacy professional or healthcare professional to tell the patient that these symptoms are constant and persisting. You must advise or you must seek the advice of a professional healthcare provider like doctor to get the root cause of what is causing this symptom to come, and that will lead to better utilization of self medication. And it is better always to advise the patient to give the medicines which are OTC. Other than OTC products, we as pharmacists can at least do one thing, that ask the patient to go to the healthcare provider or a medicinal practitioner to get the prescription, and after that we give the prescribed medication to the patient. Because at the end, self medication and drugs, they do not discriminate. वो इतना डिफरेंशिएट नहीं करेंगे कि कौन ले रहा है, वो हर रोज ले रहा था, वो फीमेल है, मेल है, इंडियन है, नॉन इंडियन है, कौन है. They will just kill the person slowly and slowly as a poison. At this point, I will end my presentation and I will welcome the question and answer if you have any.
Yes, any delegate or any participants having any of the questions, you can write it in the chat box.
Should we conclude, madam?
Sir, there is one question
Yes, sir.
in the chat box.
Yeah, carry on.
Yes.
Okay, so Disha madam, the question is, in the USA, is there self-medication prohibited? This is a question.
Actually, whatever we consider as medicines which are OTC in our case, say simply cetirizine or azithromycin or paracetamol, which are schedule H drug, जो हम लोग ऐसे ही ले रहे हैं, in developed countries they are prohibited to take by their own. So in developed countries like USA, UK, even for simple this symptoms की treatment के लिए, you have to meet their medical like practitioner, and they will advise you for this medication. So वहाँ पे yes, the self medication is prohibited for these drugs. There is one more question.
Yes, yes.
What to do when doctors prescribe antibiotic as soon as they hear the word fever? In this case, with every doctor, yes, that is the case with every doctor. When they hear fever, they start with antibiotic. But as far as it is a duty of a doctor to correct this thing, that as जैसे ही fever का नाम आए वैसे ही नहीं जाना चाहिए. It is our duty as well to wait for 2 to 3 days at least when we have fever. At least हम as a pharmacist what we can do is हम अपने friends और family को तो इतना बोल ही सकते हैं that immediately when you have fever तो आप नहीं जाओ. So in that case it is like वो हमारी responsibility में भी आएगा. So like डॉक्टर्स को हम लोग इतना नहीं मतलब डील कर सकते. एज अ फार्मासिस्ट हमारी ड्यूटी में जो आता है, आई थिंक वी शुड लीव अप टू आवर ड्यूटीज एंड ऑल. नेक्स्ट वन इज आयुर्वेदिक में इतने ज्यादा डोजेस लेते हैं तो उससे साइड इफेक्ट होती है. तो जैसे मैंने बोला, इफ यू हैव टेकन इट विद द लाइक कंसर्न ऑफ आयुर्वेदिक मेडिसिनल प्रैक्टिशनर, तो उसने अगर प्रॉपरली डोज दिया है तो वो ठीक है. दूसरा ये भी है कि बिकॉज हर्बल मेडिकेशंस आर नॉट ऑलवेज एक्सट्रैक्ट्स, तो इन केस ऑफ एक्चुअल मेडिकेशंस क्या होता है दैट वी हैव टू टेक द हायर डोज. तो इन दैट केस इट इज ओके, बट एक बार आयुर्वेदिक मेडिसिनल प्रैक्टिशनर को दिखा के या बोल के इफ स्टार्ट द आयुर्वेदिक प्रैक्टिस, देन इट वुड बी मोर अप्रोप्रिएट. Next is only OTC products can be self-medicated. Right, can be self-medicated. Other than that, like not go for self-medication. And next and last one is for migraine patient, how much tablet given to him or her? Well, for migraine patient, it is advisable to go with the doctor or medicinal practitioner. And in that case, the doctor will see the severity of migraine and how old the migraine is. Then in that case, the doctor will be able to provide the prescription about the dose and like कितने डोज में लेना है, कितने टाइम लेना है, कितने टाइम तक लेना है. तो ये सारी चीजें looking at the history of the patient will be able to join, like say. Sometimes doctor prescribe two antibiotics together, so is it safe or not? कई बार ऐसा है that the antibiotics अगर वो दो एक साथ लेते हैं तो they provide the synergistic effect, जैसे एमोक्सिसिलिन एंड क्लेवुलेनिक एसिड. तो इन दोनों को जब भी कंबाइन करते हैं तो वो एमोक्सिसिलिन के रेजिस्टेंस वाले स्ट्रेन के अंदर काम आता है. तो इन दैट केस द डॉक्टर कैन प्रिस्क्राइब टू एंटीबायोटिक्स टुगेदर.
Yes, Ghanshyam sir, now you can conclude.
Yes.
Shall we conclude?
Yes, sir. Yes, sir.
Yes.
Now you can.
Thank you. Thank you, Disha madam. Madam give the profound knowledge on the self-medication. In that, madam covered the why the self-medication occur. She also explained the potential risks behind the self-medication. Madam had given information about habituation, allergic reaction due to the self-medication, and it's really very informative and very knowledgeable session for all of us. So on the behalf of Sharda School of Pharmacy, I once again thanks to Disha madam to provide or share their knowledge with us. Thank you so much, ma'am.
Thank you very much. Thank you. It is my pleasure.
Thank you, ma'am, once again. Okay, now today we are going to end up this today's session of refresher course. Tomorrow we will going to meet at 10 a.m. For our next 3 session. કાલે આપણે પાછું આવી જ રીતે કાલે 3 સેશન છે આપણા બીજા દિવસ રિફ્રેશર કોર્સના તો બધા જ ડેલિગેટ અગેન કાલે સવારે 10 વાગે પોતાના જીએસપીસી ઓનલાઈન પોર્ટલ પરથી લિંકની અંદર જોઈન કરી શકે છે. Today we are ending up the session, so thank you everyone for joining. Thank you once again.
Thank you, all of you.
Thank you.